What's up, guys? Okay, so as you know from the title of the video, we're going to talk about a couple of things, a couple of changes, a couple of new things that I'm considering. So first, let's talk about interviewing. So I did make a video about interviewing before, but I just want to let you guys know about something concerning interviewing that I have noticed and what I experience. So with jobs that want to fulfill their position, like today, they usually don't ask you a whole lot of questions about yourself. They have your resume, they know what you're capable of, they know your qualifications. So what they basically do is just give you a rundown of who they are, the job, what they expect of you, and they ask if you have any questions or concerns concerning what they explain to you. I got that on 2 occasions. I got that when I was interviewing for my first position as a CNA at a hospital, and I got it today, interviewing for a position for home care. So the interview went great. I was interviewed by 2 people, and they were really nice, and they basically gave me a rundown of the job. It wasn't anything about you because I'm on the paper. Everything about me is pretty much on the paper. So they didn't ask me those type of questions. It was just, this is the job, this is what we do, this is what you're gonna do if you get hired, and this is what we expect of you. And they gave me like stories about about what happened to them and what they experienced when they were working out in the field, and it was based off of questions that I asked them. Because I've been doing a lot of researches on YouTube, and sometimes that's not good. I wasn't really getting the answers that I wanted concerning home care. It was just a day in the life. You see people making coffee. I hate those type of videos. People making coffee and they're doing it here. I'm like, all right, just give me the information already. I really don't care about all of that. I want to see what you do as a nurse in this position. I don't care what you ate this morning. That's just me. I'm sorry, but videos like that get on my last nerve, and I wasn't getting what I needed. So I just went ahead and I asked them, what is your worst day, as a home care RN, and what does that look like? Because this is what it looks like at the hospital. And one of the things that the manager told me was her worst day at in home care is still her best day, at the hospital. So it was like, and I asked, would you ever go back to the hospital? And they was like, no. A quick no. So I don't know. I'm still considering it. I'm thinking about it. And it has nothing really, let's talk about my possible career change. So it has nothing to do with working as an RN in a hospital. It has more to do with my family. I've been doing this for 12 years, working night shift as a CNA, and then here I come as a nurse doing the same thing. So it's to me, because I've been doing it so long, it's the same thing, just different responsibilities, or not even different responsibilities, just more responsibility on top of what I already had. So it's the same thing. The transition wasn't really different. I was just learning a new role, new responsibilities, but it was all the same thing. So I want to be more present with my family when they are home. And I already missed the first half of my daughter's life after I give birth to her because of school. And now that she's in kindergarten, you know how they have all these little shows, and it's Christmas time getting ready to come up, and they have little things that they do, but it's after school when I have to go to work. And my husband is there, my other kids will be there, but mommy, I want to be there. She's going to remember mommy was not there. So it's more to do with family life. I want to be home now when they're home. I do want to have more hospital experience because I'm looking toward the future. Like if I want to go for a different position, they usually require more than 2 years, depending on the position, of acute care. So I don't know if I'm going to stay, if I do get hired, stay PRN at the hospital. Knowing me, I'm not going to do it. But I'll probably stay on, but I won't pick up any hours. Um, I don't know. That's still up in the air. I'm still praying about it. I don't really know what to do. I was hoping, really, that this position was like, because I applied for two positions. First, the PRN, because I wanted to get my feet wet, see if I liked it. If I didn't, then I could just bail out. But they scratched that position. It was like, okay, we're hiring for full time. We need somebody full time here. So I'm still thinking about it. I'm thinking about the future. I am in school getting my BSN, and then from there I'm going to go get my MSN in education. I really want to move towards education, but there are opportunities for education in home health care, just as the same as with acute care. So I'm kind of pretty good on that, I think, but I did want to have a little bit of more experience. So I'm still thinking about that. I'll let you guys know what my decision is going to be. But the interview process was basically, this is what we're going to do, this is what we're doing, this is what we do, this is what we don't do. And I think it depends on your interviewer, but you still should come to your interview prepared with the answers to those types of questions, because usually it's the same type of questions. Like, what was the hardest challenge that you ever had with your patient? Little things like that. I was asked those type of questions. What is your strength? What is your weakness? Tell me about yourself. And with the tell me about yourself questions, what I usually answer with, I don't tell them, oh, I have 3 kids and I'm doing that and all of that. Sometimes I do, but I really focus on what am I doing in my career right now. Like, I am in school getting my bachelor's degree, and my plan is to get my master's directly after. I am currently precepting, learning new leadership skills, things like that. I don't answer with, oh, my age and I grew up here or I live here, things like that. It's always towards my nursing responsibilities. What am I doing in nursing, and how I am progressing as a nurse, and what am I doing to move up or get better, what kind of courses I'm taking to be more educated, if I'm getting certified, things like that. That's the tell me about myself answer that I give to the interviewer. What else? That's it, guys. Just come prepared with those basic questions, and also come prepared with that question, because they're going to ask you, what was your hardest patient? What did you do for them? Things like that. They like those type of scenario based questions to give you, because they want to see how you work through problems. Are you going to get ghetto with it and come out your face and start, trying to fight people? Or are you going to handle this situation with emotional intelligence, basically? Because you get a lot of people, you're dealing with a lot of personalities, and you can't just unleash on people. They want to see if you know how to keep your calm and in certain situations. And as a nurse, especially in the hospital dealing with doctors and different team members, you do have to keep your cool, because you can't just come out at people like that, because it's unprofessional, it's not necessary, and it speaks a lot about your character and how you need to grow and develop as a person. You can get your point across, you can get things done without all of this argumentative back and forth, and I need to prove to you or show you that, you can't talk to me like this. It's just not cool. Different ways to handle it, especially if you're trying to move up or do different things. People are watching you. People see that, so don't mess up your future goals and things like that with little things that you couldn't control about yourself. To get control of those things so that it won't mess you up in the long run. That's personal growth things. I think that's it, guys. Yeah, so I'm thinking about it. If any of you are in home health care, let me know. I did ask them about the documentation, because I was watching YouTube videos and it was like, oh, the documentation is horrible, it's crazy, it's worse in the hospital. But when I was new to documentation in the hospital, it took me forever. But I can document like that and be done on all of my 6 patients. If I have 6 patients within an hour, head to toe assessment and everything else that I have to chart on, and I'm done. And I'm just trying to manage their care through the night. And that took a couple of months for me to kind of get a system down. And I believe if you have a system and you stick with that system and you work that system, you can get through anything. But yeah, guys, I think that's it. So if you're working in home health care, let me know what it is and what your experience is. Not home health care with an agency, because agencies is different from working with home health care from a particular hospital. They own this thing. You know, it's different. If you have that type of experience, let me know. Because I know those are 2 different experiences, and I don't need the agency one because there's a lot that go with that, and they're trying to make their money. But here with the hospital, I know it's totally different. So if you have that experience, let me know. Or even if you just have general, even with that, just let me know, you know, what it entails, really, what was your hardest day. That'll be helpful because I'm not finding nothing on YouTube. Just making coffee and driving. That's all I'm saying. I'm getting annoyed. Okay, guys. So with that, thanks for watching. Talk to you guys later. I will give you an update when I learn more information and when I come to a decision. Thanks for watching. Bye.